Let's talk about the invisible system we all depend on to stay healthy, the pharmaceutical supply chain. It's one of those things you never think about until it breaks. And right now, it's not just breaking, it's being completely reimagined from the ground up. We're in the middle of a once-in-a-generation shift, moving away from a system that lurches from crisis to one that's actually built for resilience.
So, what's pushing this massive change? Well, it really starts with a single number, 323. In 2024, that was the record-breaking number of active drug shortages right here in the US. And this isn't just some abstract statistic. We're talking about critical treatments for cancer, for infections, for heart disease. It's a huge, flashing red light that the old way of doing things just isn't working anymore.
For decades, the entire industry had one guiding star: make it cheaper. The whole game was about optimizing for the lowest possible cost, no matter where on the planet that took you. But the shocks of the last few years have taught us all a really painful lesson. A cheap supply chain is a fragile one. So now, the new obsession isn't cost, it's resilience.
And this focus on resilience, it's more than just a new buzzword. It's a fundamental change in how leaders think. The entire definition of what makes a supply chain good is being completely rewritten.
I mean, just look at this contrast. Before 2020, success was dead simple. Did you cut costs this year? That's it. That was the whole game. Fast forward to today, and the new metric is risk-adjusted value. The planning window has gone from 1 year to nearly a decade. It's a massive shift from short-term tactics to long-term strategic survival.
So what does this new strategy actually look like in the real world? Well, it looks like one of the biggest manufacturing shifts in modern history. Companies are bringing production back home.
And listen, this is no small bet. We are talking about over 150 times billion dollars in capital being committed between just 2023 and 2027 to move and build new manufacturing facilities on domestic soil. It's a gigantic financial endorsement of this new resilience-first mindset.
Which, of course, brings up the million-dollar, or in this case, billion-dollar question. We all know labor and construction costs are higher in the US and Europe, so how on earth can this possibly be a smart move financially?
Well, if you use the old math, it doesn't. Not really. As you can see here, the base cost of manufacturing in the US can look anywhere from 40 to 80% more expensive than in a country like China. If you stop your analysis right there, you would never, ever make this move.
But this is where the new math completely flips the script. The second you start adding in the true cost of risk, things like tariffs, quality control headaches, IP theft, having to hold tons of extra inventory, that giant US cost premium absolutely plummets from around 60% all the way down to just 22%. And suddenly, the financial case for onshoring looks undeniable.
Now, this huge physical shift in manufacturing isn't happening in a vacuum. It's being enabled and, frankly, accelerated by some incredibly powerful new technologies.
And at the very heart of this tech revolution is the digital twin. Put simply, it's a perfect virtual copy of your entire supply chain. It lets you run simulations, stress tests for disruptions, like a hurricane or a factory fire, and predict problems before they ever have a chance to happen in the real world. It's like a crystal ball for your operations.
And the impact is just staggering. Companies that are putting this tech to work are seeing production downtime cut by as much as 80%. They're seeing inventory costs drop by up to 35%. These aren't just small tweaks. These are total game changers that boost both resilience and the bottom line.
But here's a really crucial reality check. While AI is transformative, it is not a magic wand. Research involving huge players like Bristol-Myers Squibb found that for products with really stable, predictable demand, simple classic inventory models work almost as well as super complex AI. So the lesson is, use AI like a scalpel, not a sledgehammer. Aim it at your most volatile and complex challenges.
So you have this combination of new risks and powerful new technologies. And it's forcing every single company to make a fundamental strategic choice about what they want their future supply chain to actually be.
And that choice really boils down to this. Do you build a fortress or do you build an ecosystem? The fortress model is all about vertical integration and total control. You own everything. It's really expensive, but it's perfect for protecting high-value blockbuster drugs. The ecosystem model, on the other hand, is all about partnership and agility. You leverage a whole network of suppliers, which gives you incredible flexibility, especially for more mature products with unpredictable demand. But of course, the smartest companies aren't just choosing one. They're using a hybrid model. This matrix kind of lays out the logic. You build a fortress around your crown jewels, your high IP,
high-value products. But for everything else, especially products where demand is all over the place, you leverage the speed and agility of an ecosystem.
Okay, so the strategy is clear. But how do you actually execute a transformation this massive without disrupting the critical day-to-day business of getting medicine to patients? The answer lies in a really disciplined 36-month roadmap.
It's a 3-year journey. Phase 1, the first 6 months, is all about the boring but absolutely essential stuff, governance and cleaning up your data. You simply cannot build a high-tech supply chain on a messy foundation. Phase 2 is where you start building new muscles, launching pilot projects for things like digital twins. And then finally, Phase 3 is where you take those successful pilots and scale them across the entire enterprise.
Now, a transformation on this scale, it requires a pretty significant investment. You're talking about a total cost somewhere in the ballpark of $186 to $309 million over those 3 years.
But the return on that investment is incredible. The projected value in today's money is $2.4 billion, with the entire project paying for itself in just 3.5 years. So you see, this isn't just an expense. It's a critical investment in survival and a massive competitive advantage for the future.
So let's boil all of this down to 5 key actions. First, the supply chain needs to be a board-level priority. It's that important now. Second, clean your data before you even think about AI. Get that foundation right. Third, make sure any new tech you bring in meets all the strict regulatory standards from day one. Fourth, get rid of your single points of failure, especially in high-risk parts of the world. And fifth, collaborate. The future is about building powerful ecosystems, not just bigger factories.
We've covered strategy, technology, and finance. But this all comes down to something really simple: making sure that medicine is there when you or someone you love needs it most. So the question isn't just for executives, it's really for all of us. When it comes to our health, what do we value more? The absolute control of a fortress or the adaptive agility of an ecosystem? The answer is going to define the future of medicine.